Hello everyone, welcome to this short Prideway refresher course. This session will include an overview of standard ops, including flows of medicine and the standard worksheet. We will also recap cycle time, lead time, TAKT time and the time observation form. So what are standard ops? They are methods of observing and analysing processes to find out how we can work more efficiently. To start off, we are going to recap the flows of medicine and the standard worksheet. Here is an example of the flows of a porter collecting medication from pharmacy and delivering it to the wards. The yellow lines depict the porter and the orange lines represent the medication. Remember that when completing your standard worksheet, anywhere a patient travels will be drawn with a red line, whilst family or loved ones will be a brown line. The movement of the provider, which are the members of staff, will be a yellow line. Any medication moving through the process, as seen in the example above, will be an orange line. Any supplies that are moved, for example, retrieving items from a store cupboard and taking them to their point of use, will be a blue line. To demonstrate the flow of information, whether this be written, verbal or electronic, a green line should be drawn. Here we can see all the information travelling back and forth in the process of booking a patient an appointment. When doing your standard worksheet, don't forget to include the WIP in the information boxes at the top. The WIP is the amount of work in the process at that moment in time. A black line should be drawn for any equipment that is used or moved around, for example, a blood pressure machine. And lastly, a purple line should be drawn to show how you would like the process to look after improvement work has been completed. Don't forget to determine and document which process you are observing, including the boundaries and the operators. Record the time and date of the observation and watch the process a few times before starting to map out the flows on paper. And try not to lift your pen off the page. Number the steps so it is easy for other people to follow the flows of the process. And don't forget to add quality checks as a yellow diamond and any safety checks as a red cross, shown in this example. Now we'll recap cycle time and lead time. Cycle time is how long it takes one operator or machine to complete one cycle of work, measured with a stopwatch. Lead time is how long it takes to provide the whole product or service, also measured with a stopwatch. TAKT time, on the other hand, is not measured with a stopwatch. Instead, it is calculated and is the pace or drumbeat of demand. So here you can see the individual cycles of work. Each coloured box at the top is a different cycle of work. At the bottom of each cycle box, you can see the individual cycle times. The lead time is the entire length of the process. So the total time for all the individual cycles, including any time between the cycles. Remember that before starting your lead time observation form, it is important to watch the process a few times in order to determine the steps. You should document between 6 and 10 observations on the time observation form. So here is an example of a lead time observation form. As this is a lead time, the boundaries are patient enters team 1 to patient leaves team 1. We'll go on to doing separate time observation forms for individual cycles shortly. At the top, you can see all of the information boxes have been filled in, including the TAKT time, which we will recap in a moment. Remember, for each of the steps, you need to document the time the step starts. For example, in step 2, we can see patient checks in, and Zoe has written 5 seconds. So the patient started the process of checking in 5 seconds into the observation. In step 4, we can see the patient started waiting 1 minute and 39 seconds into the observation. So always glance down at your stopwatch and document the time as soon as a new step starts. After documenting all of the timings, you then need to calculate the time in between the steps. Zoe has written these here in blue. For any walk or wait steps, it can be helpful to mark these with a W for ease of reference as seen here. You can then fill out the summary boxes at the bottom of the form. Time for one observation will be whatever end time you clocked at the end of the observation. See here Zoe's end time of 5 minutes and 24 seconds. Then you need to add up all of the walk and or wait steps you marked with a W. Subtract this walk and wait time from the time for one observation. This will be your processing or hands-on time and goes in the box at the bottom. You can then find the most frequently occurring time, known as the mode, recorded for each individual step, and enter it into the column over on the right. If you cannot identify a most frequently occurring time, you can document the middle number, known as the median, instead. Don't forget not to use the mean. If you have any outliers, using a mean will throw the rest of the data and will not provide an accurate representation of what you observed. You will then use the timings documented in this right-hand column to calculate your overall lead time, walk and wait time, and processing time. So just now we looked at a lead time observation form which showed timings for the entire process from when a patient arrived in Team 1 to when the patient left Team 1. Now we are going to look at a cycle time observation form to observe and document the individual cycles that are taking place within the boundaries of that process. For example, booking in at reception might be one cycle within the overall lead time. Patient being sent for an X-ray before seeing the doctor could be another individual cycle. So remember, the cycles are the individual chunks of work and the lead time is the time it takes the overall process from start to finish. Here is an example of Zoe's cycle time observation form. You would observe and document the timings in exactly the same way as we discussed for the lead time observation form. TAKT time can be described as the pace of customer demand or the rate by which work needs to be finished in order to meet demand. Going back to Zoe's cycle time observation form, we can see the TAKT time calculation at the top. TAKT time is calculated by dividing the time available by the demand. So here, time available was 240 minutes. 240 divided by the demand of 59 patients gives us a TAKT time of 4 minutes and 4 seconds. Here is another example of TAKT time. This means that every 8 minutes and 30 seconds, a TTA should be moving along one step in the process in order for pharmacy to meet their demand for that day. Another way of thinking about TAKT time is that it is the ideal cycle time. If you're watching this video and need to complete your assignment for session 2, you will need to observe and document the flows of your chosen process on the standard worksheet, remembering to use the correct colours and adding in the quality, safety checks and also the work in process. Then you will need to observe your chosen process at least 7 times in order to document and complete your time observation forms, including all of the information boxes and summary boxes. You will need to include your waste walk form and complete the TAKT time calculation sheet. And don't forget to use the standard operations audit tool to ensure you have included all of the necessary elements in your standard ops tools. This is the end of the refresher course. If you have any questions, please contact your coach or email us at sm-kpo.